Hi, Dr. Brian Heaberlin here with Lexington ENT and Allergy, and today I'm going to talk about ear infections. The technical term for the type of ear infection I'm going to describe is called acute otitis media. So that's a middle ear infection. More technically speaking, that's an infection that occurs below or deep to the eardrum in this space we call the middle ear. I've talked in another video about outer ear infections or swimmer's ear, otitis externa, but this is a different thing. So, otitis media is a very common problem in children under the age of 2. The way our ears work is we have the eustachian tube that goes from the middle ear and it empties out into the back of the nose, and the eustachian tube is responsible for keeping air under our eardrums. Whenever we swallow, our eustachian tube's open a little bit, and that allows the air to balance and keeps the pressure under our eardrums the same as the outside world. If that's not working well, and it often doesn't work well in young children, then bacteria from the nasopharynx can come up the eustachian tube and get in here and cause an infection, and often, even without infections, just fluid develops. The suction pressure can pull the eardrum down and pull fluid from the surrounding tissues into the ear, and if fluid's there, then children don't hear well, and they're prone to getting ear infections over and over again. So if a child has had fluid in their ears for 3 continuous months, then often they would need to have ear tubes placed in order to alleviate this pressure. So the way ear tubes work is they are a small tube that goes through the eardrum, and it balances pressure, so it kind of bypasses that dysfunctional eustachian tube. The ear tubes are designed to stay in place for about a year. The body grows sort of under the eardrum and ejects the eardrum, ejects the ear tube rather, and that tube will work itself out through the ear canal and eventually just fall out. So ear tubes usually stay in place for about a year. That can vary, but on average about a year. And so ear tubes can do a fantastic job at eliminating recurrent ear infections and fluid in the ears. This is not only a problem of children. We put ear tubes in adults all the time for fluid in the ears and other ear problems, but mostly it's in young children. So if you know someone that's getting frequent ear infections and it's not being handled well enough with just antibiotics and kind of waiting it out for the child to grow out of the problem, then have them go see an otolaryngologist where we can evaluate them to see if they would benefit from having ear tube placement. Thank you.